Have you ever left your toenail polish on just a touch too long, or maybe you've been wearing artificial nails for a long time, you go to take them off and all of a sudden you see these bizarre looking white marks on your toenails, maybe your fingernails. It could be spots, it could be lines, and you're freaking out going, oh my gosh, have I developed some gnarly nail fungal infection? Do I have some sort of mineral or vitamin deficiency? Am I dying from the inside out? Listen, before you continue on this panic train, take a deep breath, because in today's video, we're going to be talking about these mysterious white marks on the nails. White spots, white lines. The medical term for this is leukonychia. There are several different types of leukonychia, white spots, and many underlying potential root causes. We're going to cover some of the most common in today's video. But first, you have to understand the basics of what leads to white marks on the nails. The white marks on the nails can appear that way due to reflection of all wavelengths of visible light off the surface of the nail, obscuring the underlying nail bed vasculature. This is known as a true leukonychia. When you press on the white mark, it's not going to go away. It's something actually going on in the nail itself, not underneath the nail. And this implies that there is a problem going on at the level of the nail matrix, specifically the distal nail matrix. The nail matrix houses the machinery, the cells that build your nail plate. And some sort of trauma or injury to the distal nail matrix, which is that little white half moon that you see with your eyes, some sort of problem going on there leads to abnormal keratinization, and the cells are not quite turning over right, almost like the cells in your pore. When they don't turn over right, you get a clogged pore, a blackhead, a whitehead, otherwise known as a comedone. Well, here, instead of that, because there's nothing to clog, you get this funky looking white spot. True leukonychia is different from another type called apparent leukonychia. Apparent leukonychia, in contrast to true, will blanch when you press on it, and the reason is because in contrast to true leukonychia, which arises due to a problem in the distal nail matrix, apparent leukonychia has to do with some sort of compression of the underlying blood vessels that make up the nail bed. So it's a nail bed problem, not a nail matrix problem. And that might be related to something causing compression of the blood vessels, swelling, tissue edema. And it gets a touch more complicated in that you can have something called a pseudo leukonychia. Pseudo leukonychia happens due to something causing direct trauma to the nail plate. In contrast to true and apparent leukonychia, pseudo leukonychia are these white marks, they can be spots or lines, that if you scrape at them, this white chalky material comes off. The reason for this is that something external, some sort of problem external, caused disruption in the ability of those nail cells to lie down properly. So it's kind of like the equivalent of flaky, scaly skin on the face, except in this instance, it's going to be flaky, scaly nail cells on the nail plate. It's called a pseudo leukonychia. Doesn't have to do with a problem in the nail matrix, and it doesn't have to do with a problem in the nail bed. It is a surface nail issue. The most common leukonychia is a true leukonychia where you have little white spots, and this is most often seen in young children related to trauma of the nail, distal matrix. It won't blanch when you press on it. One nail may be affected, or several nails may be affected. Different nails may be affected in different ways. And the spots can change as the nail grows out. The most common myth I hear about these nail spots is that they are a warning sign of low calcium or low iron. That's not true. While underlying nutritional deficiencies definitely can cause different types of leukonychia, they do not cause this punctate true leukonychia that you see commonly in children or people who have maybe had manicures. It's just related to trauma to the distal nail matrix, not an underlying nutritional deficiency. Some cases you might develop these little white spots secondary to an underlying chronic skin condition or hair loss disorder like alopecia areata or psoriasis. The other true leukonychia are the formation of transverse white lines that run parallel to the little half moon. These were first observed and described as Mees nails. They're usually about 1 to 2 millimeters in diameter. These were first observed in association with arsenic poisoning. They can be seen about 60 days usually after exposure to arsenic. But This is not the only cause of these horizontal white lines, a true leukonychia. You also can develop these transverse white lines, a true leukonychia, secondary to trauma. And often we see this in people who maybe forget to trim their toenails or like to keep their toenails long, or they wear tight-fitting shoes, real narrow, pointy toe shoes that compress the toes together. Creates a lot of pressure on the free edge of that long toenail, and that leads to trauma of the distal nail matrix, because this is a true leukonychia, and the formation of those horizontal white bands. You can also develop these as a result of other things that traumatize, like the nail folds, and lead to damage to the distal nail matrix, such as if you develop a wart in this area and you go to the dermatologist and they freeze it with that liquid nitrogen spray. Well, unfortunately, a bystander injury of that treatment might be to damage the distal matrix and lead to the formation of this true leukonychia. It's not permanent, provided you are not continuing to have that liquid nitrogen spray for the rest of your life. Now, you might need multiple liquid nitrogen spray treatments to get rid of the wart, so it might take a long time for this to go away if that's something that you develop. Other traumas to the nail folds can lead to the formation of these transverse white lines, such as trimming the cuticles, pushing the cuticles back, aggressive manicures. Provided the underlying root cause is addressed, it does take some time for this to grow out. The fingernails grow roughly 1 millimeter every 6 to 10 days, so it does take some time for this to grow out once the underlying root cause has been addressed, alleviated, and removed. Trauma would lead to the formation of these transverse white lines only on the nails that are affected by the trauma. But if you see someone, or you yourself have developed white horizontal lines that affect all 10 fingernails, all 10 toes, that is more worrisome, that there's something going on internally that might be affecting the nail matrix. We see this with patients who take chemotherapy medications to treat cancers. Chemotherapy can impact the nails in many different ways. Check out my video all about chemotherapy and skincare around chemotherapy. I give a lot of tips and warnings about what might happen, but it definitely can lead to the formation of these because it affects those cells in the nail matrix. Now, I know the word toxin gets thrown around a lot in the wellness space and is very vague, so let's be clear. Thallium, arsenic, strontium toxicity can lead to the formation of horizontal white lines on the nails, a true leukonychia, because it is damaging the nail matrix. Horizontal leukonychia might also be seen with underlying nutritional deficiencies or underlying autoimmune disease, namely lupus erythematosus. Check out my video all about the warning signs of systemic lupus erythematosus. I do mention in that video that nails can be affected, and the development of a true leukonychia is one such way. And who here likes to hike at altitude? Well, that can put a lot of wear and tear on your body. Due to the altitude, you can develop something known as Everest nails, seen in people who, hike Mount Everest, which is very taxing on the body due to, hypoxia. The oxygen content up there is not that great, and it affects the body in many different ways, including, of course, your nails, because the cells are vulnerable to that hypoxic injury. Also, the medication used to treat and prevent altitude sickness, acetazolamide, might also contribute to a certain extent to the formation of true leukonychia. Let's talk about apparent leukonychia, not a problem with the nail matrix, but rather a problem with the nail bed. Apparent leukonychia can be seen if your albumin, a protein in the blood, gets way too low. This might happen if you have underlying kidney disease or severe malnutrition. When the albumin drops so low, it leads to a problem with swelling due to the inability of your blood to retain fluid. It leaks out, and so this can essentially result in tissue edema in the nail bed, leading to an apparent leukonychia. It's known as Merkey's lines. You see the formation of these pale bands that are parallel to the half moon, to the lunula. What about vertical white lines? Have you ever seen those on someone's nails? Vertical white lines or longitudinal leukonychia could be true or apparent. True in that it affects the distal nail matrix. Causes of this might include underlying hereditary diseases. Something known as Dray's disease can lead to vertical white lines alternating with vertical red lines known as candy cane nails. Longitudinal true leukonychia may also be due to some sort sort of abnormality in one part of the nail matrix, such as the growth known as an onychomatricoma. You also can have a longitudinal apparent leukonychia, meaning it will blanch, of course, with compression, and it's not due to a problem in the nail matrix, but rather, you guessed it, the nail bed. Apparent leukonychia is in the bed. A nail bed tumor known as an onychopapilloma can lead to the formation of a vertical white line that goes away with compression. All right, now that we've covered some of the causes of true versus apparent leukonychia or white spots, white lines, what about pseudo-leukonychia? That's something that has to do with something coming and sort of causing problems from the outside into the nail itself, making it crumbly, and if you were to pick at it, you get this powdery white stuff. If this is happening on your fingernails or your toenails, the most common reason for this is actually secondary to nail cosmetics. Repeatedly exposing the nail plate to artificial nails, nail glue, or to nail polish remover can actually damage the nail plate in those areas, mess up the nail itself, make it kind of mushy, white, and crumbly. Also can dry out the nail and lead to a pseudo-leukonychia. So it's not a problem with the nail matrix, it's not a problem with the nail bed, it's just a problem due to injury of the nail plate itself, locally disrupting the ability of the nail cells to remain lying down in the nail plate. These nail cosmetics essentially lead to the dehydration of the nail keratin, and so those nail cells lift up and you get flaking. The other reason for a pseudo-leukonychia, remember, not a problem with the matrix, not a problem with the bed, is actually a fungal infection. This is known as superficial white onychomycosis. The nail fungus invades the nail plate and causes these crumbly white spots. This is most commonly going to be something that happens on the toenails. It's very, very rare, very uncommon to have nail fungus of the fingernails. If it's on your fingernails and you've been wearing artificial nails or doing nail cosmetics, manicures, nail polish, probably related to that. But if it's happening on your toenails, one might need to consider it could be a toenail fungus. All right, guys, so that's a broad overview of the main categories of white spots on the nails. Remember, there's true leukonychia, which affects the nail matrix. There's apparent leukonychia, which affects the nail bed. And then there's pseudo-leukonychia, which has to do with something coming externally and causing trauma to the nail cells of the nail plate, leading to basically they're lifting up and flaking around. Leukonychia can be punctate, meaning little spots. It can be horizontal. It can be longitudinal. Now, leukonychia can go away provided you know what the underlying root cause is and you treat and control that. For example, if you've got arsenic poisoning, there's no cuticle oil out there that's going to correct the white spots. For example, if you have a white superficial onychomycosis causing a pseudo-leukonychia, those crumbly white spots, well, you're going to need to be treated with oral antifungal medications. The topical antifungals are unlikely to cut it, at least most. Usually requires a medication given by mouth so that it can make its way into the nail itself, and it does take time. You want to be really careful with your nails, practice gentle nail care, no pushing the cuticles back, I don't care how gently, no using cuticle clippers, just be really gentle. Keep the nails trimmed short, especially the toenails, because that pressure on the distal tip of a long nail can lead to those horizontal white lines. Also, limit the application of things to the nail that can be very irritating, can cause contact dermatitis, such as nail glues, nail polish removers, or even nail polish itself, which can contribute to drying out of the nail. Make sure your shoes fit well. Tight, poorly fitted shoes can cause a lot of pressure on the toenail, leading to leukonychia. Also, you might need to have your gait analyzed. Abnormal gait, maybe there's a problem, say in your hip or whatever, and you're not putting even pressure on your feet and you kind of turn in your foot. Maybe you have a neuropathy, for example, related to, I don't know, diabetes, or maybe you had a cancer treatment that left you with neuropathy. Well, that that can lead to abnormal gait, unnecessary pressure on the nail, and ultimately lead to the formation of leukonychia. Frequent use of moisturizers, provided you're not allergic or irritated by them, can also help. I'm a big fan of using plain petroleum jelly around the nail folds to help prevent the access of irritants that could cause a contact dermatitis and further slow nail growth. Also helps to protect the nail matrix from unwanted moisture getting up under there. Moisturizers with urea, lactic acid, salicylic acid, glycolic acid, all can really help with the health of the nail plate as well. So those would be some interventions that you might consider, but again, you've got to identify the root cause and go after that. Otherwise, you're not going to get anywhere. I really hope this video was helpful to you guys. On the inside, I'm going to put my recent video all about why you have those pesky vertical nail ridges and how to get rid of them. So check that one out next. But if you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.